there is a lot still going on in regard to anti-angiogenics. And let's talk about two multikinases still. One of them is lenvatinib, and in first line, and also the ramucirumab story, especially in the high elevated alpha-fetoprotein. Can you tell us about both? Richard?
Yes, so lenvatinib is a multi-targeted kinase inhibitor, not too dissimilar from sorafenib in its kinase profile, a very potent VEGF inhibitor. It has shown significant activity in thyroid cancer, where it has an indication, and now there's recent data in renal cancer as well. And many years ago, a phase 3 study was launched comparing sorafenib to lenvatinib in the frontline setting. This is an open-label study and was driven, like many of the studies in frontline liver cancer, based on a relatively small phase 2 experience, about 35, 40 patients, but had a very provocative overall survival in the 15 to 17-month range, which is not a number we've seen in frontline in general. It was somewhat of a mixed population of patients, but needless to say, it justified further exploration, and we should know in the near future the results of that frontline study. You also alluded to the study with ramucirumab. Different from the molecules we've talked about so far today, ramucirumab is a monoclonal antibody to the VEGF receptor. It has had proven activity in gastric cancer and colon cancer and also lung cancer. And the question of its role in liver cancer was based on some early phase 2 data, again, small single-agent experience, even before the sorafenib approval. That had an interesting frontline survival of around 15 months. Needless to say, a second-line large placebo-controlled study was conducted, and that actually was a negative study. There was no benefit to ramucirumab over placebo in that phase 3 study. However, there was a pretty strong biomarker effort to try to identify a group of patients that benefit, and it's been demonstrated that those patients who had a baseline elevated alpha-fetoprotein in their serum of greater than 400 was a group of patients that did get a survival benefit. Interestingly, for those patients who had an AFP less than 400, placebo and those that got ramucirumab had a median survival around 11 months. The curves completely overlapped. However, in those patients who had a high baseline AFP, again, similar to the MET story, high AFP is a poor prognostic factor, but it also identified a group of patients, and it wasn't a small group, it was about 100 patients per arm, that received a survival advantage with the addition of ramucirumab. So, with that data in hand, there's been a very strong commitment to pursuing that data in another phase 3 study. This study is ongoing, and again, for patients who progress on frontline therapy with sorafenib, they're being randomized to placebo or ramucirumab intravenously only if they have a high AFP. That is an inclusion criteria. So again, a smarter way maybe of developing drugs in liver cancer, still to be proven, but selecting a group of patients who you think have a greater chance of benefit from receiving treatment.